Have you ever wondered what your doctor really thinks when you step into the exam room? It's not a thought most folks like to dwell on. But the reality is, beneath those friendly nods and expert voices, some physicians harbor quiet opinions about senior patients that can influence the care they deliver. These thoughts aren't always positive, and they're seldom discussed outright. Still, they can impact how your concerns are taken, how your care plan is built, and what choices you're presented with. In this video, we're diving into 5 surprising realities about what a lot of doctors truly feel toward older folks. Grasping these is key to ensuring you receive the dignity and focus you merit in any doctor's office. Hang in there till the finish, because the last one could totally shift how you handle your upcoming visit. All right, let's jump right in. Number 1. They frequently figure most issues are simply due to getting on in years. One of the toughest things many seniors deal with is when physicians rush to blame their troubles on the inevitable march of time. You could show up mentioning sore joints, constant tiredness, or fuzzy recall, and rather than probing further, you hear, that's typical for someone your age. Sure, growing older brings shifts, but this quick judgment can cause wrong calls on what's wrong and hold back fixes for problems that are genuine and fixable. The risk? Labeling something as age-related kills the drive to check it out more. That huffing and puffing might get shrugged off as just winding down, but it could signal heart trouble brewing. The odd lapse in memory you bring up might be waved away as a quirky old-timer thing, though it might tie to a pill's reaction or thyroid glitch, both sortable. When age becomes the go-to answer, chances to head off issues or bounce back slip away. This attitude isn't usually mean-spirited. Docs are swamped, racing through loads of appointments daily. Hearing a common gripe from an elder, it's easy to lean on the straightforward fix. Trouble is, straightforward ain't always spot on. Things like mood dips, nutrient shortages, or budding tumors get missed this way, dragging out folks' discomfort needlessly. Take my acquaintance, an 85-year-old chap named Harold from Toronto. He started feeling wiped out and a bit woozy now and then. His GP first brushed it as age catching up, suggesting more downtime. Only after Harold pushed for deeper checks months on did they spot an anemia issue from low iron that a simple supplement fixed. Post-treatment, his pep came roaring back, and he'd often grumble about wishing they'd listened sooner. Folks in their later years need to keep in mind that it's just age isn't a catch-all for every niggle or shift. Bodies evolve, yeah, but those evolutions warrant a proper look, not a dismissal. A nagging hack, mystery pounds dropping, or abrupt stiffness calls for real scrutiny. Age be damned. When physicians push past age assumptions, they find stuff that, once handled, boosts daily ease and lifespan. As the one in the chair, pipe up, quiz 'em, and insist on real digs, not pats on the back saying it's par for the course. You merit the same sharp sleuthing a 30-something gets, 'cause your well-being holds equal weight at 75 as at 35. Now, let's think a bit deeper about why this happens so often. In medical training, there's a lot of emphasis on common patterns, and aging is painted as this broad category where decline is expected. But life isn't a textbook. Everyone ages differently, based on genetics, lifestyle, diet, exercise, and even where they live. For instance, someone who's been active all their life, eating well and staying social, might have symptoms that point to something treatable, not inevitable decay. Yet, because of time constraints in clinics, where a doctor might have only 15 minutes per patient, it's tempting to categorize quickly. This can lead to a cycle where seniors feel dismissed, which makes them less likely to report issues early, worsening outcome. Studies from places like the American Geriatric Society highlight how this assumption contributes to underdiagnosis of conditions like osteoporosis, where bone pain is written off as old bones. But early intervention with meds or therapy could prevent fractures. Or consider urinary issues often chalked up to age, but could be infections, prostate problems in men, or pelvic floor weaknesses that physical therapy fixes. The emotional toll is huge too. Feeling unheard can lead to anxiety or depression, which then spirals into physical decline. It's like a domino effect. To combat this, preparation is key. Before your appointment, jot down symptoms with details. When they started, what makes them worse or better, any patterns. Bring a family member or friend for support. They can help advocate. If the doctor says it's age, ask politely but firmly, what else could it be? Can we test for that? This shows you're informed and pushes for thoroughness. Resources like patient advocacy groups in Canada or Europe offer templates for such conversations. In the UK, the NHS has guidelines emphasizing person-centered care, reminding professionals to avoid ageism. Across the pond in the US, Medicare encourages second opinions. Remember Harold? After his experience, he became a bit of an advocate in his community center, sharing tips on self-advocacy. He even switched to a geriatric specialist who focuses on older adults' unique needs. These specialists are trained to disentangle age from disease, often catching things general practitioners miss. If you're in Europe, look for gerontology clinics. In North America, ask for referrals. Expanding on the example, Harold's anemia was from a vitamin B12 deficiency, common in elders due to absorption issues, but treatable with shots or pills. Had it gone unchecked, it could lead to nerve damage or falls. Similar stories abound, like a woman in her 70s from New York who had fatigue dismissed, only to find out it was sleep apnea, fixed with a CPAP machine, letting her enjoy grandkids again. These cases show how assumption robs years of quality life. Prevention is another angle. Regular screenings for cholesterol, blood pressure, cancer can catch issues before symptoms. But if doctors assume symptoms are age, they might skip recommending them. Empower yourself with knowledge. Sites like Mayo Clinic or WebMD have senior health sections. Ultimately, shifting this mindset starts with dialogue. Doctors are human. Many want to do better, but face systemic pressures like insurance limits or burnout. By speaking up, you not only help yourself, but contribute to better care for all seniors. It's about reclaiming agency in your health journey, ensuring every visit counts toward vitality, not just survival. So next time, walk in prepared, questions ready, and remember, your body may age, but your right to comprehensive care doesn't. Yeah, it's frustrating, but knowledge is power here. Use it to turn the tide. Number 2, they might reckon seniors aren't as good at sticking to care routines. A lesser-known fact is that certain doctors quietly assume older folks won't or can't keep up with health directives like the young crowd does. This idea mixes old cliches, prior encounters, and hidden prejudices. If they think you'll struggle with a regimen, they could dumb it down in unhelpful ways or skip fancier paths entirely. Meant to simplify, it often shortchanges you on top-notch care. This springs from worries over recall, hearing slips, or juggling pills. A doc might muse, too much info, and it'll slip their mind, or this script's too fiddly. While some elders do hit snags there, painting everyone with that brush is off base. Plenty in their 70s or 80s handle nitty-gritty plans, log doses, and even dig into their ailments for smart picks. Holding back full details robs you of picks that could transform your health. Say, an expert might bypass chatting about a newfangled joint fix, figuring you wouldn't bother with the hassle even if you're game. Or they skim over how tweaks and habits could team with meds for steadier pressure. Either way, you're short on facts, missing your shot at the ideal fit. I chatted once with a lady named Susan, 76 from London, fresh with a diabetes nod. Her initial endo handed a bare-bones setup, guessing she wouldn't chase anything taxing. But Susan craved full involvement. Switching specialists, the new one laid out all angles from combo therapies to meal shifts and walks. Armed with that, she nailed her management way better. That's why showing your doc you're all in matters. Jot notes at visits, request printouts, and grill 'em on fuzzy bits. Proving you're on it chips away at notions that elders can't tackle involved stuff. At day's end, adherence isn't age-tied. It's about drive, backup, and straight talk. Spotting your dedication, docs open up on all fronts, letting you snag the route to peak health and vibe. If this is hitting home and you're still tuned in, drop number 2 in comments to say, hey. And if you're not subbed, hit that button, and bell keeps you looped in. Your cheers fuel more stuff like this to spark and teach. Onward we go. Delving further, this belief often roots in statistics. Studies show adherence drops with complexity, and older adults sometimes face cognitive or physical barriers. But that's averages, not individuals. Many seniors use apps like MediSafe for reminders or pill organizers, proving capability. In Canada, programs like the Seniors Health Knowledge Network educate on managing regimens. Europe has similar initiatives through the EU's aging policies. The bias can stem from training gaps. Medical schools are improving, but older curricula focused less on geriatrics. Consequences? Suboptimal outcomes, like uncontrolled hypertension leading to strokes because a full plan wasn't offered, or diabetes mismanaged, causing complications. To counter, build rapport, share how you've handled past treatments successfully. Bring a caregiver if needed for support, not dependency. Tools like wearable trackers, Fitbit, can demonstrate commitment by sharing data. Susan's story expands. She was a retired teacher, tech-savvy, using spreadsheets for glucose logs. Her first doctor overlooked that, but the second embraced it, incorporating app recommendations. Post-switch, her A1C dropped significantly, avoiding insulin. Another example, a 82-year-old from Seattle with COPD got a simplified inhaler plan, but wanted pulmonary rehab. Insisting, he joined, improving lung function dramatically. These illustrate how engagement flips the script. Broader tips. Research options beforehand via reliable sources like the NIH or NHS websites. Join support groups, online forums on Reddit, or AARP communities. Share strategies. Pharmacists are allies too. They explain interactions clearly. Systemic changes help. In the US, value-based care incentivizes better adherence support. In the UK, integrated care systems aim for personalized plans. But individually, preparation shines list questions. What are all options? Pros, cons. How can I track this? If complexity overwhelms, ask for phased implementation. Remember, non-adherence costs billions yearly in health systems, so doctors benefit from invested patients. By demonstrating reliability, you dismantle stereotypes, fostering partnerships. It's empowering, turning from passive to proactive, ensuring care matches your capacity, not assumptions. Over time, this builds confidence, reducing visit anxiety. For families, encourage elders gently, offering help without patronizing. Ultimately, it's about mutual respect. Doctors provide expertise. You provide commitment. When aligned, health thrives, proving age is no barrier to mastery over one's well-being. It's a game changer. Really small steps like note-taking lead to big wins in control and outcomes. Number 3. They could lean toward giving younger folks the edge in tight spots. It's a prickly pill, but occasionally, physicians subtly favor the young when clocks tick and supplies thin out. Not from spite. Often, it's tied to thinking youth has more road ahead. So bold moves pay bigger dividends. For elders, though, this means dialed-back haste, scarcer check-ins, or getting past for ops that'd still pack punch. In jammed ERs or offices, a harried doc might pour extra minutes into a 20-something, betting their tweak yields decades of gain. Flaw there? It skips how vital sprucing life quality is anytime. A 70-year-old earns the same shot at vigor, self-reliance, and zero aches as a 40-year-old. Betting on age solo ignores how spot-on care amps an elder's freedom, pride, and everyday spark. At times, this skews test picks an elder hears, "No need for scans, 'cause woes seem age norm," while a youth with matching gripes gets rushed in. Or it sways op chats, where a doc dodges suggesting one, assuming bounce back's brutal, sans asking if you're up for it. I recall talking to a fellow named George, 78 from Chicago, hit with hip woes bad enough to hobble him. First ortho-nixed replacement talk, claiming age made it overkill. George, fit and fired up, hunted another view. The second doc weighed his real shape, not calendar, and post-op, George healed fine, back to golf swings he'd yearned for. Key point: age is just a slice of the pie in health calls, not the whole. Your fitness, outlook, and aims count heaps. So, chat frank with your doc on care wants. If you sense sidelining for youth, voice it or shop opinions, stressing your value on time, ease, and tomorrow's flips chat from how many years left to how grand can they be. And that pivot upgrades your treatment big time. Exploring this more, resource allocation in healthcare often follows utilitarian principles, where years saved metrics influence decisions subconsciously. In overwhelmed systems like the US's fragmented insurance or Europe's wait-listed public health, triage favors potential longevity. But ethics, bodies like the AMA, stress, equity, arguing quality-adjusted life years, should factor enjoyment, not just duration. For seniors, this bias manifests in subtle ways: longer wait times for specialists, fewer rehab referrals, or conservative pain management. Take cancer screenings. Guidelines sometimes cap at 75, but fit elders benefit. A study in The Lancet showed older patients get less aggressive chemo, even when viable, reducing survival odds. Emotional impact. Feeling devalued erodes trust, leading to delayed care seeking. George's case deepens. He was a former marathoner, maintaining fitness. His first doc ignored that, but the second assessed VO2 max and bone density, approving surgery. Recovery involved PT tailored to seniors, proving resilience. Similar, an 80-year-old from Montreal denied cataract surgery, initially as low priority, but advocating got it done, restoring driving independence. Strategies. Document health history, showing vitality, exercise logs, volunteer work. Use patient portals for follow-ups. In Canada, provincial health lines offer advice on escalation. Europe has ombudsman for complaints. US, Medicare appeals processes. Broader advocacy. Groups like Age UK or AARP lobby against ageism. Books like Elderhood by Louise Aronson unpack these dynamics. Families can attend visits, asking, why not this option? Preparation includes knowing rights under HIPAA or GDPR. Access records to challenge decisions. Ultimately, reframing conversations to goals like, I want to dance at my granddaughter's wedding, humanizes you. Shifting priorities. This not only secures better care but empowers, turning potential victims of bias into architects of their health narrative. It's tough to face, but awareness arms you for fairer fights in the system. Number 4. They might downplay the weight of your dreams and pursuits. A sneaky insight is how some docs may be unaware. Guess at what drives older patients. They could think by 70s or 80s, you're all about ease and basics, not chasing passions, pastimes, or fresh adventures. This filters into guidance and fixes they pitch. Assuming bare survival's your gig, they might miss paths to keep you buzzing, roaming, or diving into faves. For instance, you flag shoulder twinges, and they zero on pill-patching pain, skipping surgery, or PT chats that'd let you swing tennis again or hug grandkids, sans wince. Or they push the swift, simple route over bolder ones, figuring no interest in sweat for sweeter wins downline. This caps you if your horizons stay wide and vivid. There was this gal I knew, Margaret, 83 from Vancouver, eyeing a cruise to see family afar. She battled arthritis, and her first roomie urged just homebound comfort. But Margaret sought thrill. Telling a fresh doc her vision, he crafted a plan with targeted stretches, med tweaks, and travel tips. Half a year on, she sailed off, calling it a peak joy. Moral: Your aspirations count, age aside. Be it tending blooms, clubbing up, or epic jaunts. Care ought to fuel 'em. If docs skip life probes beyond vitals, volunteer yours. Spill hopes and quiz how treatment aligns. Viewing you as full-fleshed with visions, not steady-state case. They customize for impact. That spells not mere extension, but enrichment. If you're glued and digging this, comment number 4 to chime in. Not subbed? Do it now with Bell ensures no misses. Your boost keeps us churning inspo and info. Let's press on. Digging deeper, this assumption ties to societal views of aging as retirement from ambition. But many seniors reinvent starting businesses, traveling, learning instruments. Doctors, trained in disease management, might overlook holistic care per WHO's active aging model. Impacts? Treatments that maintain status quo, not elevate. For chronic pain, meds over rehab that enables hobbies. Margaret's expansion. A widow. Her cruise was emotional healing too. The doc included mental health referrals. Holistic approach yielding joy. Another. A 79-year-old from Boston wanting to paint again. Hand tremors dismissed as age. But specialist found Parkinson's early meds, restoring dexterity. Tips. Start visits with Beyond Health I Want to Goal. Use tools like life goal worksheets from gerontology sites. In Europe, integrated social care links doctors to community programs. Canada has wellness centers for seniors. US, senior centers offer classes aligning with health. Research. Journals like Gerontologist show goal-oriented care improves adherence and satisfaction. Families. Encourage sharing dreams. Attend visits. Challenges. If shy, practice with mirrors or friends. Systemic. Training programs now include motivational interviewing to elicit goals. Books like The Art of Aging inspire. By voicing aspirations, you guide care toward fulfillment, proving later years can be vibrant chapters, not footnotes. Its inspiring dreams don't expire, and neither should support for them. Number 5. They could shortchange how feelings tied to growing old hit your health. Lots of docs laser on body stuff, but some gloss over emotions' massive role in total wellness, particularly for seniors. Maturing ain't solely joints, pulses, and blood work. It's navigating goodbyes, self-shifts, and maybe less autonomy. Skipping heartside leaves plans half-baked, ignoring core wants. Often, a doc pins blues, worries, or pulling back on old age blues instead of treating as fixable. They might bypass loneliness, sorrow, or tomorrow fears, because it's off-script. Yet these mind bits straight up sway body ops, like rest, eats, defenses, and heal speed from bugs. I think back to a guy named Frank, who'd lost his partner after 50 years together. His fitness tanked fast, but visits stuck to pill tweaks. Nobody probed coping or home help. A pal nudged therapy, and Frank perked up, body-wise too. Not from drug swaps, but easing soul load at last. Hurdle? Elder feels can hide, especially if you mutter, fine, to how ya. That's why spill true beans, even seeming off-topic. Sharing lows, strains, or isolation ain't whining, it's handing full intel for aid. Ignoring aging's feels leaves folks invisible and adrift. Sapping body rebounds quietly, but tackling 'em sparks sharper results. Zip and drive. Solid docs get treating whole you means mind and frame. Sometimes a field chat rivals any script in power. Expanding on this, biopsychosocial models emphasize emotions' interplay with health, yet time-pressed docs prioritize measurables. Loneliness, per CDC, rivals smoking in risk, boosting inflammation. Hypertension. Grief can mimic heart attacks. Anxiety erodes immunity. Frank's tale. Post-therapy, joined a bereavement group, regaining appetite and activity, lowering blood pressure naturally. Another. A 77-year-old from Amsterdam with insomnia dismissed, but counseling revealed retirement identity loss. CBT fixing sleep without pills. Strategies. Use PHQ-9 screeners to broach mood. Apps like MoodPath track emotions for sharing. In Europe, mental health integration via GPs is strong. Canada offers senior hotlines. US, Medicare covers therapy. Resources. APA's Aging Psychology section. Books like The Body Keeps the Score link trauma to health. Families. Notice changes. Encourage talks. Challenges. Stigma. Many from eras where mental health was taboo, but normalizing helps. Systemic. Training in geriatric psychiatry grows. By opening up, you enable comprehensive care, weaving emotional resilience into physical strength for fuller lives. It's crucial. Emotions aren't extras. They're essentials in the aging puzzle. Wrapping up here, these revelations might stir a mix. Maybe you're relating hard from your own run-ins, or feeling a tad irked, even stung. But spilling them isn't to bash every doc or erode faith. It's to flag that your vitality and worth need full spotlight, honor, and tending across life's span. Arming with this lets you stride into checkups bolder, firing smart queries, ensuring you're heard loud. Getting older doesn't dim your shine. Actually, your tales, smarts, and grit are untestable treasures, core to you. You earn care, seeing you wholly, beyond ailments or dough. If ever brushed off, don't bow out. It's cue to assert. Hunt fresh views, or land a provider prizing your uniqueness. From what I've seen, top health wins bloom when you and doc team up. Be candid on fears, seek clarifications on mysteries, and own your role actively, not sidelined. That stance nets you the focus, regard, and deep care due. So tote this wisdom ahead. Let it steer to tighter, kinder bonds with health guardians. And always recall, your journey, saga, and glow matter as fiercely today as yesteryears. Cheers for hanging out. Spill in comments, one takeaway, and how you'll wield it. Your shares fire us up huge. If this clicked, like, sub, share fuels more gems to light and lift. Catch ya next time.